Right. Okay, so I hope all of you are seeing the screen nicely. I'm going to answer the questions in the end. So we'll slowly go through what an anal fissure is. The reason I thought, okay, we answer questions very quickly, we'll go to the next stage. We'll deep dive into a particular problem, and then we can sort of, answer the questions. Most of the questions I will be able to answer. All the other questions, you can put it down in your chat box, and I will do it in the end. Okay, so yeah, almost ready to start. Okay, 1 minute, let's see. Yeah, okay, so anal fissure, very common problem. It's one of the trinities of anal conditions. Okay, I say trinity because there are three important conditions. And for those who don't know, I'm Venkatesh Munikrishnan. I'm a colorectal surgeon at the Apollo Main Hospital in the Chennai Colorectal Clinic. So there are three important conditions which happen around the anus. One is piles or hemorrhoids, very common. Another one is an anal fissure. The third one is anal abscess or anal fistula. So there are three important conditions to remember about. Common perianal. These are things which happen around your anus, okay, around the bottom, right? Now, I'm just going to go through some normal anatomy. This is very important. If you understand, you don't have to become an expert. If you become one, great, I'm very pleased, because then you are my soldiers. But just understand it a little bit more, and then, I think it makes all our lives easier, because when you have a problem or someone has a problem, you should be able to sort of give them a little bit of advice just to improve what they can do. So this is normal anatomy. Okay, so when you eat food, the food goes through the food pipe, goes into the stomach where the food is digested. Okay, and the digested food is churned, broken down, and then it slowly comes down into the small intestine, where the juices from the liver, the pancreas, and all these glands produce juice out to digest the food. Okay, very important. So the small intestine is a very, very important, piece of intestine, which what it does is it takes all the important minerals or the nutrients which the body needs and sends the waste material out. Now, as the food comes down in this, it can be 2-3 meters long, this or more. Sometimes the small intestine comes to the large intestine, which is a couple of meters long. Now, between the small intestine and large intestine, there is a valve. Okay, so the material in the small intestine is liquid. Now, this material finds its way, and the valve opens every now and then as with pressure, and goes into the large intestine. Okay, large intestine. Now, the function of the large intestine, which is the colon and the rectum, is to absorb water. So absorb water and what it does. This does is it makes the waste content more solid. So if you don't drink enough water, whatever water content is there will be absorbed, and the stool will become more hard. Yeah, simple concept. Just remember this. I've told you so many times, but you got to remember that's why water is very important. Also, what you eat. So if you eat a lot of red meat, not enough vegetables, then the stool content is going to be hard, and then whatever water will be absorbed, and it will become even more harder. And that's when constipation evolves. Okay, so remember this. Keep it simple. Eat well. Drink lots of water, exercise. These are all simple things which you have to, put in mind as you start to understand these things. All right. So this waste matter finds its way slowly through the colon. It has got, the intestine also got like a little engine which pushes the waste content forward, and it slowly finds its way to the end of the colon and finally comes to the rectum, right? The rectum, the function of the rectum is to store the stool. Okay. Now, and when a time is right, it will work with this complex mechanism around the colon and in the rectum and the anus to expel or put the stool out. Now, I'm going to repeat this in Tamil very quickly for our mother tongue locally, so in very quickly, so it benefits people because there are lots of Tamil people here, and some of them may not understand or want more clarity. So quickly I'm going to go through that. Okay, so நம்ம சாப்பிட்ட சாப்பாடு வந்து இந்த சாப்பாட்டு குழாய் வழியா இறங்கி இரைப்பைக்குள்ள வந்து இந்த ஃபுட் வந்து டைஜஸ்ட் ஆகி அந்த ஃபுட் வந்து சிறுகுடலுக்கு வருது. சிறுகுடல்ல இம்பார்ட்டன்ட் ஜூசஸ்ல கலந்து அது இன்னும் ஃபர்தர் டைஜஸ்ட் ஆகி broken down சின்ன சின்ன பீஸ் ஆகி முக்கியமான சத்துகள் விட்டமின்ஸ் இதெல்லாம் வந்து சிறுகுடல்ல அப்சார்ப் ஆகி தேவையில்லாத பொருட்கள் வந்து பெருங்குடல் வழியாக வருது. பெருங்குடல்ல வந்து பெருங்குடல் வேலை என்னன்னாக்கா மலத்தை நேரம் மலக்குடல் கொண்டு போன ஒண்ணு. ரெண்டாவது மலத்தை வந்து அதுல இருக்க ஈரத்தை உறிஞ்சணும். அதனால்தான் மோஷன் வந்து ஈரமா இருக்கிறது வந்து ட்ரை ஆகி மலம் மாதிரி ஃபார்ம் ஆகி அப்புறம் ஃபைனலா மலக்குடல்ல வந்து ஸ்டோர் ஆகி அப்புறம் மலக்குடலும் ஆசனவாயும் சேர்ந்து அதை வெளியில தள்ளும் அட் அ சூட்டபிள் டைம். சரிங்களா? தட் இஸ் வாட் பேசிக்லி யூ நீட் டு அண்டர்ஸ்டாண்ட் தட் அபவுட் this anatomy. So that's in Tamil is fine. Okay, so just to quickly keep everyone happy, keep me happy also. So then let's look at this more closely around the anus. What happens? So the rectum is itself 15 centimeters. Okay, it's a capacious organ, stores the motions in there. Then and if you look at this lower bit, now this anus is where is the anal orifice through which motions come out. That's where if I go to the doctor's office, we put our finger and check. Okay, and we will find a few things and we can advise. Now if you look at here, there are the wall of the rectum. The rectum is like a tube, and the muscles, these are the other white pink muscle is a pelvic floor muscle. Pelvic floor, so abdominal inga one irukum diaphragm between the lungs and the abdomen. கீழே வந்து pelvic floor இருக்கு. pelvic floor வழியா தான் rectum, the urinary system, the urethra, அப்புறம் vagina, all these things go through the pelvic floor to come out, right? So that is why you have to have in mind that any damage to the pelvic floor will cause disturbance of all these problems, particularly women. I personally think that women actually should be celebrated more because they do all the hard work. Men, I think, just have fun. Okay, you guys do hard work too, but I think they work harder. So just be nice to them, yeah, because they bear children and they can and childbirth can cause damage to this entire area. So that's why I'm saying be nice to them. Buy them whatever they want today. Do something for them. I'm sure you do, but do something more today. Okay, right. Anyway, coming back to the subject. Now, so if you see here, this is where the motion is stored. Now you see these blue little things in the, so this is the internal muscle, is the inner pink muscle, and the external muscle is the part of the, the external sphincter. So these two muscles control the motion so that it doesn't come out. So when you go to the toilet, or when in the morning, when motion comes and sits over here, there is a message. This is a complex neuroanatomy, which message goes to the brain to automatically relax this inner muscle, and then this outer muscle, which is under our control, like your biceps, for example. So the inner muscle is like your heart, right? Automatically heart keeps pumping, right? So as stool material comes here, immediately the inner muscle gets a message and it automatically relaxes. But you may be in a meeting, you may be traveling, you may not be ready. Then you use your external muscle, this outer pink muscle. The inner muscle, actually, if you look directly, it is white in color. It's like your heart muscle also is white in color. The skeletal muscles, which is the external muscle, like here, is pink in color. So that's how you differentiate it. It may not be important to you, but for if junior doctors are there, that's a useful thing to know. So, but the external muscle under your control, so you can still hold onto your, passing the motion and then wait to go to the toilet or finish your meeting, finish your webinar, and then go, right? So it's a complex mechanism. So a lot of people ask me, how do you start doing this work, doctor? It seems like boring stuff. I said, no, it's complicated stuff. Imagine the clockwork which is over there and, how people can get affected. So, so I love my job, just to reassure you guys. But anyway, so coming back to this, there's also this little blue things you're seeing here, right? These are hemorrhoidal cushions. Now around the anus, there are 3, 7, and 11 o'clock. There are 3 cushions all of us have. Now these cushions give you an airtight seal, like a washer, right? Now these cushions prevent unnecessary passage of gas or leakage of gas or liquid or mucus, so that it gives it. Otherwise, you will have leakage and your underwear will be wet and uncomfortable. So these cushions are there like a valve. Now with constipation and straining, these cushions can become larger, and when they become large, they come out. Okay, and that's when they're called hemorrhoids, grade 1, grade 2, grade 3. We'll talk about hemorrhoids next session. We're talking about fissure. Now, just to give you an idea of anatomy, because it's important to understand. So these hemorrhoidal cushions, if they're inside, it's grade 1. When they start to come, it's grade 2, and they're out and go back in, it's grade 3, and it's out completely, it's grade 4. Okay, so hemorrhoids, remember, are cushions which are filled with blood vessels, these things which are blue you see here, and when you strain, they can bleed. Usually they don't cause pain. Okay, painless rectal bleeding is hemorrhoids, or piles. But in our country and in the subcontinent and in many other countries around the world, if anything to do with the bottom, people say I got hemorrhoids. But it could be something more sinister. I will talk about it a bit later. Okay. Now, what we have to remember is that if you have a hard motion which comes and sits there, and you're not drinking enough water, you're exercising a lot, you're going to the gym, in this 3-4 months period, we all ate healthy, we thought, but we are all drinking food from Swiggy and whatnot. We're trying to exercise a lot, but are we drinking enough water, enough veggies? A lot of people did, and a lot of people didn't. And so the motion or the stool becomes harder. So when it becomes hard, it goes through, when it goes out, it will cause a problem, or it would scrape through this very sensitive area around the anal edge, right? Now, this is very important. Imagine, sometimes you cut your lip here, yeah, or it becomes dry and it hurts, it burns when you eat, masala or how it feels. That's how it will feel when you have a cut down there. Okay, so we just before going from the slide, so just to finish off. We talked about the rectum. We talked about hemorrhoidal cushions, which can turn into hemorrhoids. We talked about this sensitive area, the anal canal, and where hard motion can come and make a cut. That's the anal fissure. We'll go into detail. And you also have anal glands around here, which we don't know the exact nature of what they do, but we believe that they lubricate the motion, we think. And these glands can get infected. It's like having a pimple in the wrong place, right? Yes, that's a way of describing it. Yeah, pimple in the wrong place. Pimple you have, it bursts out, and you're done. Here, the pimple, unfortunately, bursts into the tissues in the wall of the rectum and forms an abscess, and then forms a fistula, right? So these are the 3 conditions. I just wanted to give it a because I want to reiterate in the next 3 shows. Whenever we get to them, so that you understand, these 3 conditions. Okay, so we talked about the external sphincter, the internal sphincter, the pelvic floor, and how we have to, be nice to women because they suffer more than us in everything in life. Thank them for childbearing because, as a colorectal surgeon, I know how much damage it does to their pelvic floor. So be nice to them, buy them flowers or cook their favorite food, or take them out soon, when when the lockdown opens up. Right, let's go deep dive into anal fissure. So when you come to anal fissure, so I told you, and a hard motion goes down this rectum, anorectal area, and then makes a cut in the sensitive, it forms a fissure, right? It's a crack. And this is a picture. Okay, it may look gross, but I think, what we're trying to do is to show or make you understand that that's how a fissure looks. So it's a cut. It's a cut right on the edge, and you can see this is so basic. Underneath this layer of skin, you will get the internal sphincter, and the external sphincter is outside. So you have a cut. So imagine if a hard motion comes out through that and scrapes through every morning. It is going to be hell. It was going to be severe. So people typically describe that as a or ground glass, broken glass has been rubbed in that area. So it's going to burn. It's going to sometimes bleed, but it's just severe anal pain. And I think personally think in my practice, we see about 1,500 new patients a year in our clinics. And I think majority of them coming with anal problems come with a fissure. So that is why it's common. They all call piles as a generality. And I'll tell you one little point take home, which you have to remember later. But severe anal pain and irritation after defecation. Some rectal bleeding, drops of blood. And it usually lasts for 3 to 4 hours and say up to lunchtime. And it's like terrible. And it's like, ground glass, and it's like putting a hot poker. That's the kind of, descriptions which people give for the anal fissure, right? Now, most common causes are constipation, not drinking enough water, poor diet, a lot of fast food, less vegetables, eating a lot of, food which doesn't get digested, parotas, pizzas. We all enjoy them, but you need to do it, on a balance. It's very important to have a balance, because, we're humans. We have a certain way of behaving, but behavioral change can be possible if it's going to improve your health. And I think it's very important healthcare is going to be the new luxury. As we all know, that's what this pandemic has taught us, that to, eat healthy, stay healthy. Yes, you have your excesses, but, keep them in control and check. Okay. So that's an anal fissure. It's right in the edge. So it's important. Remember, although you will feel the pain shooting up into the rectum, the cut itself is just right there. So this is important, because when we're going to give you some ointments and treatments, you just need to put around the anus, right? Not inside. So people try to, because these tubes and ointments come with introducers or whatever. So people put this right inside the anus and into the rectum, and then they may have nails, or they might, they may aggravate the fissure. So it's not necessary. All you need to do is to apply around the anal edge. The quality of the ointments will make it absorb to the, to the fissure area. And most of these ointments, will try to, there are a couple of ointments which are very standard ointments, which we use, which will relax the muscle, because the problem is, because of the cut, the internal, I told you there are two muscles, internal muscle goes into spasm. And that's when every morning, so when you go to the toilet, it's hurting. So you push as much as you can, and you say, okay, I can't finish this. I'm done. I feel okay. And then you leave. So the last bit becomes harder. So there is more content. You eat, it takes 72 hours for the food to come down. And then they all further come down into the rectum, right? And then come and sit there. So for the next day. So the next day, what was left behind from yesterday, yeah, I know it sounds gross, but understand a little bit of it, so that you can understand why you need to be proactive in managing this yourself. Okay. So this little hard bit from whatever didn't get cleared yesterday because of it was hurting has to go out first. And that tears again, makes it worse. And then it becomes softer. But then again, the patient is hurting so much. So they try to push as much as they can. And then again, they stop because it hurts again. So, so it becomes a vicious cycle, right? So the whole point is to break this vicious cycle, is to change your lifestyle. Remember all these things about gastritis, constipation, fissure, hemorrhoids. Most of these things are lifestyle diseases, and you need to watch your lifestyle. So we'll come to that in a minute. So understood this? Hopefully you understood all of this. So this is a cut right at the edge. It is painful. Remember this painful defecation or going to the toilet with drops of blood is a fissure, right? Okay. So as I said, lifestyle, putting medicines is all, you're treating the effect of a problem. You're treating the effect, putting ointment, medicines, but the cause, why you had it in the first place, right? Anything in medicine, right? If you smoke, you'll have lung problems. You can have all lots of other problems affecting every other organ. If you take steroid medications for something, you can have gastritis. You can affect, kidneys. I mean, what I'm trying to say is, you need to treat the cause. Otherwise, you will be doing things, medicine, whatever, and you'll be treating the effect, but the cost remains. So then what happens is that it becomes a vicious cycle. So lifestyle, very important. So increase your water intake, 3 liters per day. Keep drinking as much as water as you can. Fresh fruit and vegetables, right? Important. You know, in this period, I had an opportunity to go do some shopping after many, many years in India. I have not done that often, I have to be honest, but it did give me an option. So I went into the shops and, you know, so paid some money and got a bag full of vegetables. And I was impressed. It's interesting to go actually see the food you buy or see it and buy it and think, okay, yeah, it looks fresh and healthy. And we tend to eat a lot of quick food, fast food, fried food, and that's not great. Once in a while it's good, but I don't think that can be your daily thing. So try to avoid that. Eat fresh fruit, fresh vegetables. You can do cooking. Cooking's becoming a big thing these days. Everybody is trying it out. So I think you could innovate. But important thing is to eat fresh fruit. Cook at home. You could entertain your friends, show them your skills. But use fresh food. That's what I'm trying to say, which is easily digestible. Reduce the red meat. I love red meat, but I try to eat once a week as much as I can. But cutting down a lot. Fish is healthy. Chicken's fine, but important thing is to balance. Drink lots of water, have the vegetables, and if things don't work, then a simple laxative which you can get from the chemist. The problem here is that a lot of people would go straight to the chemist and take pills. Now, that's not a great idea. It's better to speak to your GP or your local doctor. And an important thing is to all of us to have a general practitioner who can take care of you as a whole. I think that concept went through the window a few years ago, and then people like me, specialists, came in, which is good, I think, for certain ways of complex treatments. But in general, you need someone to take care of you as a whole, because it's So I think post virus or this pandemic, I think it's important to have your own GP, who can manage you as a whole. And then if you need specialist help, you can always go and see. Okay, so that's that. So that's what we do. So what are the specific treatments are there? Specific treatments are there are some anal muscle relaxing ointments, which you have to see your doctor, because they can cause some side effects. Not much, but they can. Local anesthetic gels are there. You can take simple paracetamol with lots of pain, and sitz bath, where you sit in a tub of water. Now the sitz bath, again, there's no scientific evidence help, but a lot of people find a lot of warmth and comfort sitting in these tubs. So we could use it twice, thrice a day, and until you feel comfortable. The other thing is these anal muscle relax. These are the actual treatments. Okay. Now those need to be applied around the anal edge 3 times a day for a full month. That's how it works. Otherwise, they're not as effective if you use once or twice. And then the local anesthetic gels to give you some more analgesia and the pain relief. Okay. And if that doesn't work, there is a treatment called Botox. You may be surprised. Yes, the Botox which people use, to straighten their, furrows or, use on the face. So what Botox does is these things happen on your face where, you get creases because the muscles start to contract. And that's also a similar thing to where the muscles are tightening in the anus. So if you inject the Botox, then it relaxes, right? So the Botox, it has been shown, if you inject it, under sedation, you can relax the muscles for 6 months. Okay, and then the effect wears off. So you're not cutting anything, or you're not putting ointments and things. It's slightly pricey to get the Botox, but and it's a procedure. But I think it's very safe, and it if you given rightly by a specialist, there's an 80% chance of these fissures healing. So we are not performing any surgery, or the compliance is better because busy people may not be able to put ointments and things, but it's a compromise what you want to do. So that's another treatment which is available, and particularly recommend them for younger people, because particularly young women, because going back to childbirth, during childbirth, there's a 30-40% chance that the anal muscles may get damaged. Okay, so that's why I tell all of you to women have it harder than men, right? Go through more trouble. So anyway, so if you're going to have a fissure or surgery, then you cut a little bit of the muscle, which I'll tell about later. I tend to sort of give the Botox for younger women and on patients who don't want to have the risk of any surgery or, so that's an option, and it has shown to be useful. So then you come to, if all these things don't work, and then you come to surgery. Or sometimes patients will come and say, so what's the best treatment, gold standard? The gold standard treatment for a fissure is surgery, right? Even if you compare all the medical treatment, whatever is available, surgery still gives the best results. So what we do is we cut the internal muscle. I told you there are two muscles, a little bit, maybe a half a centimeter, tailor it to the fissure and cut it. So what happens is it relaxes the muscle. Immediately what happens is that tightness which was there because it was a spasm, the wound is still there, but the muscle relaxes, the motion passing is easier, and the wound takes about 2-3 weeks to heal. But within a month, 95% people are fantastic. Yeah, they do really, really well. And there is a 1 in 200 chance, that is very rare. Yeah, 1 in 200, very rare chance of quoted incidence of incontinence and all those things. But that, again, it's very rare. I don't see it in my practice, but that's what textbooks will say if you go look online. So I'm just bringing that up, but very rare. I wouldn't worry about it. If done well, it should be absolutely fine, right? So I think we've about half an hour. That's great. That's what I want to keep these sessions, about half an hour. So before going to take home, now the symptoms which we all worry about, yeah, constipation, change in bowel habits is constipation, diarrhea, anal pain, rectal bleeding. Now all these symptoms, if you think about it, they can also cause other conditions, right? One of them, the most serious one, is colorectal cancer, right? Colorectal cancer, we are seeing about 50 to 60,000 new colorectal cancers in this country every year. Yeah, that's a big number, and it's going to be rising. We're also seeing young Asian males getting rectal cancer. Now, that's an epidemic. I operate on young Asian rectal cancers, 18, 19-year-olds. Incredible, and I think we're not sure why, but there seems to be that, and it's particularly more common, getting more common as we urbanize. But what the point I'm trying to make is these symptoms, if they persist for 6 weeks, rectal bleeding, blood mixed with stool, change in bowel habit, constipation or diarrhea, which is often weight loss, anemia, or if you feel a lump or something. These are symptoms which you need to be worried about. And if it's for 6 weeks, then you need to see a specialist. I just want to put that information right here so that you can pass on the message. That's your take-home message, apart from what I'm going to give you for fissure, to go tell your friends, family, because at the end of the day, it's important to, not only discuss, what's trending on Netflix tonight and watch a show and order some food on Swiggy, but, the dinner table conversation should also be about health, because health is very important. It is the new luxury. Yeah. So educating, your friends and family about these little things will go a long way, right? Particularly this colorectal cancer, not to scare them, but to say, hey, you know what, it's going, oh yeah, a few weeks, that's fine. Just change your lifestyle, drink more water I'm not trying to make you all doctors. You can take away my work and, all the doctors. No, we're not trying to do that. What we're trying to do is to educate. It's very important because it becomes easier on you and your families and easier on us, so that you also understand, why we are educating, and you will understand when doctors explain to you. And it's also, when you visit a doctor, you will say, look, hey, you know what, this has been going for 6 weeks. I am worried I have been having something. And you may ask the doctor, can you do a rectal examination? Because still some doctors don't do rectal examinations, right? For all sorts of reasons. But you should, if you have these symptoms and if they're persistent, that you should have a rectal examination done by somebody who does that well. Okay, so that's the take-home message, main one. The next is our take-home message for fissure. So important things, if you maintain a healthy lifestyle, lots of water, vegetables, less red meat, it'll all be good. Constipation is the main cause. So, and you need to be in the toilet for less than 5 minutes. Leave the newspaper, leave the phone. I do it sometimes. Sorry, but we all do that. But that's one of the things, because you sit there, you peep phone, message, do your, you will be doing your crosswords and WhatsApping. Not a great idea, right? So leave the phone, go do your business, and get out of there quickly. So fissures, classic symptom is severe anal pain on defecation, some rectal bleeding. Change in lifestyle usually settles things down. And medical treatment, if you have a fissure and if you seek help within the first couple of months, usually the ointments and things and all work. 80-85% chance. If you've had it for a year, 2, 3, you go, then it becomes a chronic fissure, then you will need either Botox or surgery, right? Surgery is still the gold standard. It's a very simple procedure. It's a day procedure. And within a month, people are absolutely fine, right? So that's anal fissure for you, a deep dive. And I think that's good. So this will be available on the page, this entire thing. So we could, you could share it with your friends, like our page, follow us on YouTube. All these videos will be there, Instagram, so that we create lots of information which is there, safe, simple, safe, and the right message, and then patients, friends, family can just access it whenever, right? So if you have any questions, just put it in the chat box on Facebook, and I will answer them as soon as I get it. And I will see you all next week with another good topic which we'll discuss. All right, take care. Have a good Sunday. See you soon. Love you all.